Welcome everyone to today's video where we'll be showcasing the transformation journeys of multiple patients. So, let's begin with the journeys of our first 4 patients and see how their hair transplant results transformed their appearance, restored their hairlines, and boosted their confidence. After seeing these results, would you believe that all 4 of these patients had the same advanced stage of baldness? Hi everyone, I'm your hair expert from QHT Clinic, and today, I'm going to take you through the inspiring hair transplant journey of these 4 patients who came to us with diffuse grade 5A baldness. Despite starting from the same level of hair loss, their recovery timelines, graft requirements, and final outcomes were uniquely different. In this video, we'll discuss how each patient's donor area was assessed, how their hairline design was customized according to facial proportions, and most importantly, how advanced QHT techniques help them achieve natural density and long-lasting results. By the end of this video, you'll get to see their full transformations in different timelines of 7 months, 8 months, 11 months, and 18 months. So tell us in the comments, among all 4, whose results you found the most impressive. So if you're noticing any type of hair loss, don't worry. Reach out to our experts today and they'll guide you to the right solution. You can also visit the QHT clinic nearest to you, whether in Haridwar, Delhi, or Hyderabad. What is diffuse pattern baldness? Before we dive deeper, let's understand what is diffuse pattern baldness. Diffuse pattern baldness is a type of hair loss that affects the entire scalp evenly rather than forming a distinct bald spot. In this condition, hair thinning occurs gradually across the frontal, mid-scalp, and crown areas, making the scalp appear less dense over time. Diffuse grade 5A baldness. A baldness is an advanced stage of this pattern, where the thinning becomes significant, hair density is visibly reduced, and the patient may struggle with styling or achieving a full look. Let's now understand patient 1's scalp condition. When he came to us, at first glance, his frontal area appeared like an early stage of baldness. His hairline had receded slightly, but the frontal tuft still had a healthy, voluminous forelock of hair. However, upon closer examination, our experts found that not only had his hairline receded, but his temples had also receded back, affecting the natural framing of his face. Except for the frontal tuft, the entire frontal area was impacted by thinning. Additionally, the mid-scalp and crown regions were also showing noticeable hair loss. Now let's know about the patient's 2's scalp condition. His hairline has receded in an M-shaped pattern, making the frontal area sparse from the sides. Just like patient 1, he also had a healthy follicles present in the frontal tuft, but except that the entire frontal area appeared sparse and thinned. In addition, the mid-scalp and crown regions were also affected by the thinning. In patient 3, the hairline had not receded in a typical pattern. In fact, there was no visible trace of a defined hairline due to severe thinning. This hair loss was diffuse, affecting the entire scalp, including the frontal area, mid-scalp, and crown region, resulting in an overall sparsely thinned appearance. For patient 4, this stage of baldness presented differently. There were no visible traces of a defined hairline, and from a distance, the scalp appeared sparse. However, on closer examination, a few healthy follicles were still present in the frontal area and mid-scalp. In the crown region, 2 natural whorls remained intact, but the surrounding volume was noticeably reduced. The swirl pattern in the crown region was intact for all 4 patients, but the surrounding hair volume was reduced, giving the scalp a visibly thinned appearance. Fortunately, The donor area in all 4 patients was in favorable condition, packed with healthy hair follicles, providing a strong foundation for a successful hair transplant. After the detailed analysis of all 4 patients, Scalp experts move on to the next step, which was hairline design. One by one hairline was designed for all 4 patients. For patient 1, the hairline was designed measuring the distance from the glabella point, keeping the peak point at the same position. Along with it, the temples were also designed to complete the facial frame that he has lost. For the smooth transition of the hairline and temples, temporal angles were marked with precision. The frontal tuft was encircled as it won't need any intervention. The markings were extended to the crown region. The recipient area was divided in 2 parts, creating a line where frontal and some part of included these areas need high density, whereas behind it, the remaining scalp and crown region need less density as compared to that area. For patient 2, the hairline was created using a similar approach, maintaining the peak point in its original position, as it perfectly complemented his facial symmetry. His frontal tuft was also preserved and encircled. The design was then extended toward the crown to outline the complete recipient area. Unlike patient 1, his scalp required a uniform density throughout, as he had most of the healthiest follicles among all 4 patients. For patient 3, the hairline was designed to achieve perfect symmetry, complementing his facial proportions. Along with this, the entire affected area, including the frontal, mid-scalp and crown regions, was carefully outlined for graft placement. For patient 4, the design approach was similar to that of patient 3. A natural-looking hairline was crafted, and the complete thinning area was precisely marked to ensure uniform coverage during implantation. All these detailed markings served as a roadmap for the procedure, guiding the surgical team to achieve balanced density, proper direction, and a natural flow of hair across the scalp. After finalizing the hairline design, the procedure began with the administration of local anesthesia in both the recipient and donor areas to ensure a completely painless experience for the patients. Once the scalp was numbed, slit creation was performed according to the natural flow and direction of the existing hair. This step is one of the most crucial phases of the surgery, as the angle, depth, and orientation of each slit determine how naturally the transplanted hair will grow and blend with the patient's existing hair. Proper slit creation ensures a seamless transition between the transplanted and non-transplanted areas, giving a natural-looking density and flow. Following this, the extraction and implantation process began using the QHT, Quick Hair Transplant Technique, where grafts were extracted and implanted simultaneously. This advanced approach minimizes graft out-of-body time, preserves follicle vitality, and enhances the overall survival rate of the transplanted grafts. For all 4 patients, the grafts were implanted according to the zones. In the hairline zone and temples of patient 1, our experts implanted single and thin hair follicles to create a natural look, and in temples, follicles were implanted in the upside-down angle to maintain a natural flow of hair. In the affected frontal area and mid-scalp double and triple hair follicles were implanted to add volume and density. In the crown region, to add volume around the swirl, same follicles were implanted. In this case, a total of 4,800 follicles were implanted, all extracted from the donor area. For patient 2, also single and thin hair follicles were implanted in the hairline zone in an irregular pattern to create a see-through hairline. In the frontal area and mid-scalp double and triple hair follicles were implanted, and same follicles were implanted in the crown region in different angles to volumize the intact swirl. In this case, a total of 4,585 grafts were implanted, all extracted from the donor area. For patient 3, also the same approach was taken. Single and thin hair follicles were implanted in the hairline zone, and double and triple hair follicles were implanted in the frontal area, mid-scalp and crown region to add volume and density. In this case, a total of 4,800 grafts were implanted, all extracted from the patient's safe donor zone and beard area. For patient 4, also single and thin hair follicles were implanted in the hairline zone to create a soft feathered look. In the frontal area and mid-scalp, to add maximum density, double and triple hair follicles were implanted. In the crown region, same follicles were implanted at different angles to create a voluminous look around the swirl pattern. In this case, a total of 5,000 grafts were implanted, all extracted from the patient's safe donor zone and beard area. In all 4 cases, different number of grafts were implanted according to their baldness. For patient 1 and patient 3, same number of grafts were implanted, as in front both of them had the healthy follicles. For patient 2, the least number of grafts were implanted among all 4, as he had the maximum number of healthy follicles present on his scalp. The maximum number of grafts were implanted for patient 4, as his had the least number of healthy follicles present in his recipient area. In all these cases, each follicle was implanted with utmost precision to achieve natural hair growth and optimal density for every patient, ensuring results that help restore the confidence and charm they have lost. If you also want your procedure to be done with such precision, then book your slot today. 1-month follow-up of patient 1, 2, 3, and 4. 1 month after their hair transplant, all 4 patients visited the clinic for their first follow-up, an important step to monitor early recovery and scalp health. At this stage, shedding is a normal part of the hair growth cycle, and the rates varied among the patients. Patient 1 experienced approximately 40% shedding, while patient 2 showed around 60%. Patient 3 had about 70%, and patient 4 experienced 50% shedding in the transplanted areas. Native follicles in all patients continued to grow at their natural pace, and these differences in shedding reflect individual variations in hair growth cycles. During this visit, all 4 patients also received their first PRP, platelet-rich plasma therapy, which helps stimulate the transplanted follicles, improve blood supply, and provide essential nutrients to the scalp, supporting early hair regrowth and enhancing overall follicle health. To clear your doubts regarding PRP or medication, book a consultation today or ask your questions in the comments section, as many of you thought that you have to take medicine for lifetime, but it's not true. 3 months post-transplant, patient 4 visited the clinic for his second follow-up. By this time, the shedding phase had ended, which is a normal and expected part of the post-transplant cycle, and the transplanted follicles were successfully transitioning into the growth phase. At this stage, tiny new hairs were visible across the recipient areas, indicating that the follicles were healthy and responding well to the procedure. The hairline, frontal, and mid-scalp regions showed fine, soft hair growth emerging from the implanted follicles, giving the first signs of density restoration. Particularly in the crown region, the transplanted hair was starting to blend seamlessly with the patient's native hair, creating a natural flow around the swirl patterns. Both natural whorls were replicating correctly, maintaining the patient's original hair orientation, though the overall volume was still developing at this early stage. During this visit, the patient received a second PRP therapy session, which further stimulated follicular activity and enhanced scalp health. This combination of strategic implantation and supportive PRP therapy ensures that the hair continues to grow naturally, with the right direction, density, and thickness, setting the foundation for the fuller results expected in the coming months. 5 months post-transplant, patient 1 visited the clinic for his second follow-up. By this time, the transplanted hair had started growing steadily, and the improvement in his overall appearance was clearly visible. The hairline had taken a natural shape, framing his face nicely, though it still needed a little more fullness to reach maximum density. The frontal and mid-scalp areas were now showing thick, healthy hair growth, making the scalp look much denser than before the transplant. The crown area was also improving, with the swirl pattern forming naturally and the surrounding hair gaining volume to match the rest of the scalp. The direction of the hair follicles was progressing as planned, giving a completely natural look. Overall, this stage marked a major visible improvement, restoring not just his hair, but also his confidence. The final results would take around 8 to 12 months, and the hair growth would continue to improve and last a lifetime. 7 months, progress of patient 1. At this stage, the transplanted hair had grown further and matured naturally. The areas in the hairline that previously lacked fullness had now filled in, giving his face a balanced and natural symmetry. His temples had also gained healthy density, restoring the overall facial frame and framing his face perfectly. The frontal area and mid-scalp were now fuller, creating a thick and even look across the front of his scalp. In the crown region, the hair had gained good volume, and the transplanted follicles were blending smoothly with the native hair. This allowed him to style his hair freely, according to his preference. After this visit, he didn't come for a follow-up, so whenever he returns in the future, we'll share his latest update with you. For now, patient 1's hair restoration journey concludes here. Now let's learn about the remaining 3 patients' follow-up. 8 months post-transplant, patient 2 and patient 3 visited the clinic for their second follow-up. By this stage, both patients' hairlines had taken a proper shape, giving a natural frame to their faces. The frontal and mid-scalp areas showed dense, healthy hair growth, and the transplanted hair integrated seamlessly with the native hair, creating an even and natural look. However, there was some variation in the crown region between the two. For patient 2, the swirl pattern was developing well, but still had a little less volume, while patient 3's crown area showed a fuller swirl with strong hair growth all around. Such differences are common, as every individual's hair growth cycle and recovery speed vary. By this stage, patient 3 was already happy and satisfied with his overall growth, and his hair transplant journey was successfully concluded here. Patient 2's progress, however, continued further. 11 months after the transplant, patient 2 and patient 4 visited the clinic for their next follow-up, and both showed excellent progress in their hair growth. For patient 2, the results had improved even more compared to his 8-month stage. His hairline now appeared sharper and perfectly framed his facial features, giving his face a balanced and natural look. The density in the frontal area and mid-scalp had increased further, and the hair had gained good thickness and texture. The crown region also showed better growth, with the swirl pattern continuing to take shape smoothly. For patient 4, the 11-month results were equally impressive. His hairline had become completely defined and natural-looking, adding character to his overall appearance. The frontal area and mid-scalp were now full and evenly covered, giving a healthy, youthful look. The crown region replicated a clean swirl pattern with good coverage, blending well with the surrounding areas. The direction and flow of the hair appeared natural and consistent across the scalp. By this stage, patient 2's hair transplant journey reached its final phase, while patient 4's growth was still progressing toward even denser results in the coming months. 18 months after the hair transplant, patient 4 visited the clinic once again, and by this time, his hair growth had progressed beautifully. In this video, we are sharing his long-lasting results, which show how well his transplanted hair has matured over time. His hairline was now perfectly framing his facial features, giving him a natural and balanced appearance. The frontal area and mid-scalp were covered with thick, healthy hair that matched the texture and flow of his native hair, making it hard to tell the difference between transplanted and natural strands. The crown region also continued to improve, showing steady growth and a well-defined swirl pattern that blended smoothly with the surrounding hair. Across his entire scalp, the hair looked uniform, natural, and full, giving him a confident and youthful look. Now he was able to style his hair freely according to his preference, which added to his overall personality and charm. The 18-month results truly reflected the success of the QHT technique and the careful planning done during his procedure. Patient 4's journey is a perfect example of how consistent growth and patience lead to lifelong satisfying results. All 4 patients started their hair restoration journey with diffuse grade 5A baldness, yet their progress, graft requirements, and timelines were uniquely different, highlighting how individualized hair transplant outcomes can be. Patient 1 achieved noticeable results within 7 months, while patient 2 reached his final results in 11 months. Patient 3 completed his journey in 8 months, and patient 4 took the longest timeline, 18 months, to achieve his long-lasting results. At different stages, all 4 patients showed voluminous hair growth across their scalp, with uniform coverage that allowed them to style their hair freely, giving them a natural and confident appearance. In summary, although all 4 patients began with the same advanced stage of baldness, their graft requirements, recovery speed, and final density varied. This demonstrates how personalized planning, donor hair quality, and individual hair growth cycles contribute to unique outcomes for each patient. If you are also facing hair loss challenges, book a consultation with our experts today and take the first step toward restoring your hair and confidence. If you found these results inspiring, give this video a like, share it with your friends, and don't forget to subscribe to our channel for more hair restoration journeys and tips. You've just seen the transformation journeys of our first 4 patients. Now let's move on to the next patient and take a look at their hair transplant journey.
Hello viewers, in today's video, we are excited to take you through the journey of one of our patients, a 28-year-old who was dealing with the challenges of Norwood grade 4A baldness. His hair loss had progressed to the point where his hairline had completely vanished, with significant sparseness in the frontal area, and some noticeable thinning is visible on the mid-scalp area, while the crown region remained healthy and unaffected. Thankfully, he had a dense donor area with robust, healthy follicles, providing an ideal foundation for a successful transplant procedure. Hairline design is a perfect combination of artistry and science. Our experts crafted a custom-shaped hairline according to the patient's facial features, keeping the hairline slightly lower in the middle and at the precise distance of 7 cm from the glabella point. The design wasn't just about placement, it was about creating a hairline that blends seamlessly with his natural look. During the procedure, our experts implanted single and thin hair follicles in the hairline zone to create a soft, natural appearance. This careful approach ensures that the hairline blends seamlessly with the patient's existing hair, giving it a natural, undetectable look. In the frontal area and mid-scalp, double and triple hair follicles were implanted to achieve the desired density and fullness. In this case, a total of 3,500 grafts were implanted, all extracted from the patient's safe and healthy donor zone. 1 month post-transplant, the patient visited the clinic for his follow-up PRP session, a pivotal part of the post-transplant care aimed at stimulating hair growth. At this stage, our experts observed 90% shedding in the transplanted area. Meanwhile, the donor area had healed completely, showing no visible signs of extraction, even with just 1 month of regrowth. This rapid healing is a testament to the precision and skill involved in the extraction process. Two months post-transplant, the shedding phase continued as expected, and this time 60% shedding was visible in the transplanted region. The shedding phase was a sign that the new hair was getting ready to grow stronger and healthier. We kept a close eye on the patient's progress, making sure he knew this was all part of the journey towards the full natural-looking results that were just around the corner. "12 months after the transplant, his hairline had become completely defined and framed his facial symmetry perfectly. Each day, his hair seemed to gain more density, especially in the frontal area and mid-scalp, which now appeared fully restored. This transformation had been remarkable, with the hair growth now thick, healthy, and even across the scalp, offering a youthful and natural appearance. These final results greatly boosted the patient's confidence and completely changed his look. He was now able to style his hair as he wished. If you or someone you know is also facing the challenges of baldness and wants to turn the tide, then right now book a consultation with our experts. Get a full head of hair and roam around the world with a newfound confidence and an energetic look.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.